With the coronavirus still topic A in most places, we reached out the other day to Dr. Thomas Sterling, the town's deputy health officer, for some guidance on do's and don'ts. You'll be able to watch that segment either on air or online at GNAT-TV.org. But we also had the chance to speak with John O'Keefe, Manchester's town manager, about some preparations the town is making to minimize the impact of the virus. In addition to the precautions many of us have heard recently about washing hands and being sensible about working when you may not be feeling 100%, the town is taking steps as well, the town manager said.
So we're looking at it from two angles. The first one is a continuation of government. So we have some essential services that we need to ensure are continue to be provided for the public. Our water and sewer plants are of the utmost importance. The sewer plant and the water plant need to be tended to each day. So we're looking at that. Police department, fire department. So we're putting together continuation of government plans at that level. For example, police department is taking steps to make sure that they're not, for example, they typically escort the rescue squad to medical calls. And we're backing off of that right now unless it's necessary in order to limit their exposure to anyone that might be sick, so that we can continue to provide those services. We're also cataloging employees that have EMT and paramedic training. We have a couple of employees that have that training in case we need that. And then the other piece is they're just helping to manage the emergency that may or may not occur locally. For quarantine people that might be dropping off food to those folks, making sure that people have the resources to self-quarantine if that's necessary, and of course just the general outreach to people. We met with our deputy health officer yesterday, large group in this room, a couple select board members were there as well, and we got some instructions from Dr. Tom Sterling about what is the virus, really an in-depth briefing for critical town employees. I think one thing that came out of it is, to some extent, you can't wash your hands enough.
At the Manchester Select Board meeting held Tuesday, March 10th, Select Board Chairman Ivan Beatty also added a few comments.
But I don't have any official report coming out of that meeting, but we had a really good, serious discussion. And I will say that Dr. Tom Sterling, who is a part of the committee, is a good person to have at the helm of this because he has a great understanding of what it is, and he's in the medical field. And I will say for people that are watching, if you suspect that you might have been exposed or may have symptoms, don't go to the emergency room. That's not the proper protocol. Call your primary care physician. If they are unavailable, call the hospital. Both Bennington and Rutland Regional Hospitals can test. They do not want you to walk into the hospital if you suspect that you may have coronavirus. They will come to your car. So
you have to have a doctor's orders to test.
But you can't just drive down there. If you cannot get a hold of your primary care physician, you can call the hospital and they will tell you what to do.
The full impact of the virus is yet to be determined, but two other areas to watch would be schools and businesses. If it's determined that schools need to adjust their schedules, and locally at least that's not been the case so far, but this is a fluid and shifting situation that changes from day to day, we'll be following those announcements as well. Longer term, the impact on the region's and state's travel and tourism business sector is one we'll also be looking at as the course of the COVID-19 virus plays itself out. For the GNAT-TV News Project, I'm Andrew McKeever.